Ambulances responded to about 4,000 calls in the last year for what are generally considered non-emergencies.
And that's our community watchdog's latest discovery after reviewing ambulance logs in Washington and Sullivan counties. Nate Morabito found out both EMS services are going to soon start a pilot program all aimed at keeping people out of the ER.
That's right. These numbers show someone calls in need of an ambulance ride almost 11 times a day for what are generally considered non-emergencies in Washington and Sullivan counties. The average cost per trip is $274, which means it costs more than $1 million for ambulances just to drive those people. The agencies will soon train employees to become what are called community paramedics, allowing them to make proactive house calls before someone calls 911. Patients aren't just walking through the ER doors to get help with fevers, headaches, and other non-emergencies.
It's unbelievable that people go for a headache or for a toothache or nausea.
Thousands are calling 911 in search of a ride too.
I've had nausea and vomiting for 2 days, or I've had a fever for a day and a half.
And Washington County EMS Chief Dan Wheely says many of those people are repeat callers.
It certainly is a strain on the system.
EMS impression logs from Washington and Sullivan counties show roughly 4,000 ambulance trips last fiscal year for what are usually non-emergencies. More than half of those trips, 2,100 in all, for non-traumatic pain. More than 680 for what turned out to be no complaints, and at least 360 for fevers. That includes trips to all locations, including emergency rooms.
It will cut down our repeat users.
If all goes as planned, many of those patients will avoid the ER in the future.
If we can redirect those patients to a more appropriate facility, it leaves more ambulances available to respond to other emergencies.
Wheely says after paramedics are trained later this year, crews in both Washington and Sullivan counties will begin practicing what's called community paramedicine, preventative, frequent trips to patients' homes, an effort to try and figure out why they're calling 911 and come up with a more effective and less costly alternative for continuing care.
If we can follow up with them and make sure that they're following their discharge plans, they're getting their medications like they're supposed to, and have the resources at home they need to be successful, it's better for them and it's better for the healthcare system.
A health system and society that continues to pay the price in the meantime. Nate Morabito, News Channel 11, in your corner.
EMS leaders say to their knowledge, very few agencies in the state have implemented this community paramedicine program. Tennessee only recently approved the certified training program.